Good afternoon, it's Mark Larson, and here's our COVID-19 update. So we had one more positive today that was added to our total, so we're now at 79, and that report was sent to Secretary Wiesman this morning at 8:30. As of this time today, we have not heard back, but we do expect to hear back today. So keep watching. It'll be on the news, I'm sure, when we get our variance request. So that's in the works. The folks at Twin Cities did a great job. The folks at the county did a great job of maintaining social distancing, and so I'm very hopeful. So I'm going to take some questions, and then at the end I'm going to talk about masking a little bit.
Why did you not mandate the masking order? Why shop local? I think the safest thing would be to order through Amazon and stay home.
So I'm going to answer the masking at the end, but why shop local? Because people are hurting here and businesses need your money. So I would recommend that you spend your money on local businesses. There's a risk when we have Amazon deliver our packages too. So my recommendation is shop here in town, spend your money here, grocery shopping, shoes, those type of things, food, and don't head to Yakima to shop.
Has carpooling from out of county been addressed at Twin City Foods?
Yeah, it's actually carpooling from here to Yakima that's probably more of the problem, but it's difficult because not everybody has their own car. We certainly don't want people to be taking public transportation, and those folks that are carpooling, if you are carpooling with somebody, you should be wearing a mask. So that has been addressed, and some of that is dependent upon whether people have their own vehicle.
What resources exist for business during COVID-19? What are the general guidelines when an employee tests positive for COVID-19? And what are the steps that the employer needs to take to keep his other employees safe and keep his business open? So we do have an economic recovery group that is set up specifically to assist businesses. You can connect with those resources on the county website, kittitasemergency.org, or contact the Chamber of Commerce.
Yeah, and I'll answer the second part of that, which is what do businesses do when they have a positive. So if you as a business has a positive, we would get contacted by the lab with that positive. We would reach out to that particular person and determine whether or not they were at work while they were contagious. If they were not at work while they were contagious, then it would be their responsibility to contact you as their employer and say, I need to be off work because I'm positive for COVID-19. If they were at work while they were contagious, then we would be contacting you from public health, figuring out who might need to be screened, what your risks were, kind of why it might have happened, what things we could do to change things, whether more hand washing is needed, and those type of things. But we are trying as hard as we can to help people keep their businesses open.
Any idea when playgrounds will reopen, or the library?
Yeah, I haven't heard anything about playgrounds yet. I did hear some rumbling about the library being in phase 4. The real problem is, well, there's a couple. One is groups congregating together. So it may be that after a while, if libraries can be moved into phase 3, then they can limit the number of people that can be in the library and those type of things. But no definitive answers there.
Will vacation rentals be permitted in phase 2? If not, will vacation rentals be permitted in phase 3, or will it be phase 4?
Yeah, so I addressed that, well, in the economic recovery group today, there was a question about vacation rentals, and we ran out of time before it was addressed. So I did send an email back through the economic recovery group to address that question. But currently we are supposed to be staying at home, and going on vacation is not staying at home. So that's why we can't have vacation rentals in phase 1. In phase 2, my recommendation is addressing that directly to the governor, because that has not been addressed. Hotels are available as an essential service. Vacation rentals are not available, and they are not available in Kittitas County. We've been following the governor, and for example, as we go into phase 2, I've already modified our health order to allow those things that are allowed in phase 2 of the governor's stay home, stay healthy. But I think vacation rentals are a ways out. If you are a owner of a vacation rental, I would make sure that you're working on your safety plan, because every business has to have a safety plan, and we're happy to give you technical assistance on that.
What is the minimum amount of time for the county to move from phase 2 to phase 3 and from phase 3 to phase 4?
So the minimum amount of time is 3 weeks. It could be longer. I was just on a call today. There may be times when, so for example, one of the larger counties like King County may still be in phase 1, and we would be moving into phase 3. So, and that's going to make it a little difficult for those counties that are next to each other. But that's probably going to be the case. It's going to take a long time for Yakima to move out of phase 1, for example. So we may be in phase 3, or Grant County may be in phase 3, and we may still be in phase 2. A lot of that depends on how we as individuals behave, how much hand washing we're doing, how much we're maintaining social distancing and those kind of things. And that's keeping our numbers down. So as long as our numbers stay down, then we're going to be able to move into phase 3. I've not seen the details on what the criteria are moving into phase 3, but I'll let you know as soon as I hear them.
I have heard that there have been many tests that produce false positives. Can you explain or clarify this information?
Yeah, so the PCR test, which is the nasal swab, does not give you false positives. That tells you that you have COVID-19. Now, it doesn't mean that you're contagious with COVID-19, but most of the time when we're getting that swab done, it is being done because we're having symptoms. So, or we may be an asymptomatic person. But where we get into trouble with the nasal swab is it can be positive for a long, long time. So we are currently following CDC and Department of Health guidelines in regards to allowing people to go back to work on a time-based basis. So not on you have to have a negative COVID test. So the serology test, the blood tests, that one still has a lot of work to do. It's probably the best if you had COVID a long time ago, and you're looking to see whether you have had COVID-19. That test is getting better. What we don't know with that test is whether or not you've developed immunity from getting COVID again.
I have a neuromuscular disorder and am on CellCert. Is it okay for me to go to the grocery store? I wear an N95 mask, sometimes gloves, sanitize hands before and after going to the store. I do not have anyone to shop for me.
So you're more at risk, just like somebody who's older than 65 would be at risk. So it sounds like you're taking the appropriate steps. I would make sure that you go to the grocery store or go to the store when there are fewer people around. And now that we're encouraging people to wear masks when they're within 6 feet, you should be pretty well protected.
If we go into phase 2 next week, I'm wondering if it would be safe to get my hair cut. My stylist has her own salon, one client at a time, disinfecting in between. Client and stylist wear masks. I'm in my 60s, take asthma medication daily, but I'm very healthy and active. I'm not sure I should risk any exposure, but since serious care will be taken for the safety of all, I am considering going to the appointment. Yeah,
so hopefully we'll be in phase 2 tomorrow, not next week. That's my hope. And the folks in the beauty salon industry have been really good with safety because they know that they are right next to us. And so they're doing a really good job with their safety measures. And so I think it's okay for you to go get your hair done.
Would you be willing to explain in more detail what a work week looks like for you, for those of us that don't fully understand the job requirements, tasks, and responsibilities of a health official? I think there is a big majority of us who don't put much thought into this position before COVID-19 crisis.
Yeah, so before COVID-19, I was a .2 health officer. That was 1 day a week. Then I went to 1.5 days a week, so 12 hours a week. When I was doing those 12 hours a week, I looked at my hours for this year already, and for the first, well, until March 6th, I was putting in probably 20 to 25 hours a week as a health officer. So my job says 12, I'm putting in 25. Now since March 6th, so I stepped out of the clinic on March 6th because I knew that this was what was needed. I saw patients in the morning of March 6th, and I've not been back in the clinic since then. I took a leave of absence from my position at KVH. So fortunately, my health insurance comes through my wife who works at Central. But I've been putting an average of 85 hours a week since then, 7 days a week. I've had 3 days off. So that's my normal life. That's why I look pretty tired most of the time. But I appreciate the work that I'm doing, and I'm doing the work for you. So that's my normal work. It's 24/7 every day. So I think that's the end of the questions, but I am going to talk a little bit about the masking directive. So it's not a mandate. Why is it not a mandate? Because nobody likes being told what to do. And so a mandate is, or a health order is, you have to do this. That's what a mandate or a health order is. A directive is still an ask. It's no different than what I've been asking you to do for the last 12 weeks or so, which is when you go outside, when you can't be further than 6 feet from somebody that's in your little family bubble, you should be wearing a mask. That's either outside next to somebody, in a grocery store next to somebody, because you're protecting others. The data regarding masking is strong. It's getting stronger. It shows it reduces transmission. And if we are going to move into phase 3 and then into phase 4, we have to keep our numbers down. So that directive is, I direct you to wear mask. It's still an ask. It's not a you have to wear a mask, but it's thinking about others. Nobody has a right to infect somebody else. We're asking you to wear a mask. Now, we did order the folks at Twin City Foods to wear masks because we found that that's what they needed to do there, but for the general public, it's still an ask. So I'm asking you to wear a mask when you are within 6 feet of somebody that's not in your family bubble. And hopefully tomorrow we can talk about, we're in phase 2, and now what does that mean, and how can we get to phase 3? Part of it is still continuing to wash our hands, still continuing to maintain social distancing, and wearing a mask when we can. So we'll see you tomorrow. Thanks.